सिर्फ 10 से 11 दिन ही बचे हैं बजट को आने में और इंडस्ट्री की उम्मीदें तो ढेर सारी हैं। हेल्थ केयर एक ऐसी क्षेत्र है जहां पर काफी काम करने की जरूरत है और सरकार इसको प्राथमिकता भी देगी। हमारे साथ इसी पर फोकस करेंगे हेल्थ केयर ग्लोबल के चेयरमैन और सीईओ बीएस अजय कुमार जो जुड़ गए हैं। अजय कुमार साहब, स्वागत है आपका सीएनबीसी आवाज पर। स्वास्थ्य को लेकर इस सरकार में जो पहला चरण था मोदी सरकार का, हमने देखा है काफी बड़े पैमाने पर काम किया गया, अलग अलग योजनाएं लाई गई, लेकिन इसको अगर एस्केलेट करना है तो मोदी 2.0 से आपकी बड़ी उम्मीद क्या रहेगी? किस बात को प्राथमिकता दी जाए?
Regarding the budget, you are asking, right?
That's correct, sir. What do you think should be the priority of the finance minister in this budget when it comes to healthcare?
Yeah, I think in priority in healthcare, as being an oncologist and having been abroad for a long time and now 26 comprehensive centers treating cancer patients across India, one of the major things we find is people are even today paying out of pocket, and even though there are a lot of schemes, if we don't have uniform healthcare across, we need to bring a cashless healthcare system, what we call as universal healthcare. So the budget should make allocations for uniform healthcare so rich or poor will get the same care. Today what is happening is under the schemes below poverty line are getting very inferior quality of care, and the wealthy are getting different and people are paying out of pocket. This has to stop and there has to be uniformity. In order to bring that, what we have suggested is everybody should pay a healthcare tax. So that tax can be deducted from everybody almost as a mobile phone now. So that can be tagged to mobile phone and say, through let's say 1,000 rupees a year or something, because India is full of youths who are not supposed to get sick. So youth can contribute. That is what we all did when I was in US. We all contributed to Medicare system. Today, Medicare is carried by me also. I can get free care,
right.
No restrictions, any US hospital. The similar system we want to bring here if we want to become an advanced country. But doing Ayushman scheme, even though it is well-intentioned, it is not going to serve the purpose. Okay. There is going to be a great disparity. We have to close the disparity very quickly. The second thing we have to do, we know what is the effect of tobacco-related products. Either we have to put extraordinarily high tax. By some accounts, extraordinary high tax can save nearly 2 crores lives in India. 2 crores. That is the first thing. Even though we are a cancer care provider, I am telling you, our thing depends on the smokers get cancer.
Right.
I am telling you, I am ready to go out of business if they ban smoking. So they should ban smoking or increase the tax so much when the accessibility becomes less. BDs, for example,
right.
Highly toxic. The way the BDs, if you increase taxation to 70% compared to 16, what we are doing, can save millions of lives, particularly poorer section of the society.
Point taken,
who can't afford. So these are some of the simple things we are suggesting. We can really make a huge difference to the country.
I'm reading your note where you say there is a need for a larger allocation in healthcare for developing public-private partnership models. So far, the government has tried this. Have they succeeded? Or do you think it needs to be looked at from a completely different perspective?
No, they have not succeeded. Yes, they have not succeeded fully because the way they have put the system is not correct. We have to redefine what is public-private partnership. Public-private partnership is not just private people going to government hospital, set up a center. Public-private partnership is improving the cashless and improving the way the people with lower socioeconomic group can access private healthcare. Because in India, 75% of health is provided by private. So we have to make it more accessible. And government can play an important role in making this accessible. The most important thing when you look at even cancer or cardiology or some of those diseases is the quality of care. We have to start measuring outcomes. very few institutions in India measure outcome. Like we in HCG,
Right.
we have been written up by Harvard Business School. We measure outcomes. If you don't measure outcomes, what is the point in treating? Like, we get cases all the time, advanced cases coming because they are not treated improperly, technology is lacking, or they develop recurrence. So each institution should measure outcome and quality, and for that we need technology, we need proper reimbursement. I think that is where we are lacking today. The good private-public partnership where this is facilitated, and that is what we are hoping, some of these things to come up in the budget where enormous costs can be saved
Right.
by some of the measures I already mentioned, and through that, budget can be allocated for some of these innovative ways, using technology, using how we can bridge the gap
You are
between the rich
absolutely
and
right,
the poor,
Mr. Kumar.
so we can bring
You've
uniform
picked out very pertinent points. बहुत अहम मुद्दे आपने उठाए हैं. आप कह रहे हैं कि टबैको पर टैक्स बढ़ जाना चाहिए. इनफैक्ट सिन टैक्स को भारी मात्रा में लगाया जाए. आप ये भी कह रहे हैं कि आयुष्मान भारत में काफी कुछ किया जा सकता है, और साथ ही साथ पब्लिक प्राइवेट पार्टनरशिप का जो मॉडल है खास तौर से स्वास्थ्य के लिए, उसको रीडिफाइन करने की जरूरत है. वहां पर अभी भी कुछ खामियां हैं जिस पर अगर सरकार काम करती है तो बहुत ही बढ़िया स्वास्थ्य का माहौल बन सकता है भारत के लिए. बहुत बहुत शुक्रिया. प्लेजर स्पीकिंग टू यू मिस्टर कुमार. थैंक्स फॉर टेकिंग टाइम आउट. चलिए इसी के साथ मार्केट पर वापस लौटते हैं, और बाजार की चाल इस समय मैं आपको बता दूं, इसमें कुछ खास अंतर है नहीं, जहां थे वहीं है. हल्की बढ़त पर कारोबार निफ्टी में देखने को मिल रहा है, लेकिन ज्यादा जोश ब्रॉडर मार्केट में है, इसीलिए एडवांस डिक्लाइन रेशियो इस समय एकदम अच्छी और काफी बढ़िया सेहत में दिखाई दे रही है. चलिए लेंगे इसी के साथ एक ब्रेक. शुक्रिया प्रकाश आपका भी हमारे लिए समय निकालने के लिए. ब्रेक के बाद फोकस रहेगा मुथूट फाइनेंस पर.